the race for the Senate.
Welcome to the first televised debate among the three candidates for U.S. Senate from Massachusetts. I'm John Keller, political analyst for WBZ-TV, with a special welcome to viewers across the country on C-SPAN. On January 19th, Massachusetts voters will elect a senator to serve out the remainder of the term of the late Edward M. Kennedy, choosing from one of these three candidates. They are Scott Brown of Wrentham, a state senator and the Republican nominee; Martha Coakley of Medford, this state's attorney general and the Democratic nominee; and Joseph Kennedy of Dedham, a businessman running as an independent. Welcome to all three of you. We're glad to have you here. The Massachusetts universal healthcare experiment has proven much more costly than projected. What lessons have you learned from our experience here with costs that you'll share with Washington to avoid similar problems? Mr. Brown, 1 minute.
Well, thank you, John, and thank you for having this debate. And to answer that question, we have healthcare here in Massachusetts. We have 98% of the people are already insured, and we know we have to reform costs. They are getting high. And
what we need to do, I think Massachusetts is ahead of Washington. We know where we have to bring some of the costs down, and the new plan will be good for Massachusetts.
Thank you. Mr. Kennedy, 1 minute.
John, first I want to thank you for having us here tonight. And the truth of the matter is, Massachusetts has one of the costliest, if not the costliest, health insurance premium for an individual in America today. We are experiencing the greatest price inflation of any state in the country. We have to receive subsidies from the federal government to keep everything going. We have lots of middlemen that are responsible for payment back and forth when somebody goes to get care. Very rarely is an individual actually paying the doctor that they're seeing. It's going through multiple insurance companies, different brokers, and that's inflating the costs dramatically. If we are going to bring some information to that, we have to start to address cost first. And we should have addressed cost first. We should have taken tort reform into consideration. We should have ensured that people aren't getting treatments that they don't need to ensure that there's no additional litigation. And that's what we should bring first. Put costs first.
All right. Thank you very much. Rebuttal. Go ahead.
Let me add something to that. It's very important to note that when you're dealing with this particular bill, the Massachusetts plan versus the plan being pushed by the federal government, that it's not good for Massachusetts. And my role as a United States Senator is to look out for the interests of this state, not the special interests in Washington, not the Washington machine, because we need to keep a line on higher taxes, because when you lower taxes, you create more jobs. And this bill is just not good for the doctors, nurses, research facilities, hospitals in Massachusetts, and that's why I'm opposed to it.
Further comment?
Yeah, no, I just disagree, because the facts are they're complementary plans. They don't battle with each other. The AMA has endorsed the Senate plan at this stage. There are many good things, including coverage for pre-existing conditions for children. There are many things that, because we will get federal monies in, we will be able to supplement what we've been doing here in Massachusetts to cover those costs.
Go ahead, sir.
One of the premises for us doing this was to control costs. And in Massachusetts, we have not been able to. They are out of control. They are rising faster than any other state in the nation. So if we're going to do this in Washington, what we're going to end up doing is bankrupting the country. And that's bad for everybody, not just us.